Good afternoon, everyone. Here's the agenda for today. As you can see, Lauri is going to speak first because she has a meeting to go to. So I'm going to let her get to it. And then I'll speak and Erica will speak. So Lauri, off we go. Oh, and please, everyone who's a speaker, please introduce, there's a list on the podium of the order of the speakers. Please introduce the speaker after you, before you leave the podium. Thank you.
Good afternoon. As it turns out, Deanna, the Wellness Committee moved the meeting to 3 o'clock so that they could all be here, so I don't have to rush. All right, so I thought it would be helpful to the community to just refresh where we are with COVID and to just remind everyone of the practices that are in place, have been in place for months and months and have not changed. I understand that with some recent COVID angst, and so it's a good opportunity to just refresh our memories, especially because I'm sure you're hearing in the media that there are some increases in COVID cases. So I'll give you some information. So you probably are hearing that we have, as is no surprise, based on what we know about the virus, a new variant is with us, EG5. How did they come up with these numbers? George, Dr. Counts, do you have an explanation for this? Or Dr. Ben Wallace? So it is otherwise known as ARIS. And so that is now accounting for about 17% of COVID cases. There's another Omicron variant. Okay, thanks, Risa. And so it is accounting for more of the cases. And so what I think it's important to emphasize is COVID is here with us, just like influenza is with us. So it's important that we really continue normalizing COVID. It doesn't mean that we take our eye off the mark and don't take this just as seriously as we did during the pandemic, but it's just to recognize that COVID is going to continue mutating into new variants. And there is yet another one on the scene now. There is currently no federal or state guidance with regards right now to masking or social distancing. In other words, there is not enough presence of COVID that the federal government or the county officials, King County Public Health or Department of Health of Washington State are saying, please start social distancing or masking. So I just want to make that clear as well. If you are confirmed for COVID because you've tested yourself with a home test kit, or you've gone to the doctor's office, but you're not feeling well, maybe your test kit shows negative, you go to the doctor's office and are testing positive. The practice has been throughout the pandemic and remains the same. Contact me, Lauri Warfield-Larson. What happens then is I work with individual independent living residents who have been confirmed for COVID on several different things, just to refresh. One, where do you believe you may have been exposed? When did you start symptoms? The onset date of symptoms is important for setting the isolation clock and important for setting the infectious window of time of when you could have transmitted the virus to others. We talk about who you were in close contact with here in the community. I don't do contact tracing for any close contacts you may have had outside of Horizon House, but certainly I do encourage residents to let others they may have been in close contact with out of the community know so they can take action. And then I make it very clear to the residents I work with what my communication will be to those close contacts they identify. As a contact tracer, I am not permitted to disclose the name of the infected individual. Some who are infected have chosen to disclose that themselves, and that's strictly up to each of you who do become infected or have in the past. Some residents do connect dots because of communication or what they've heard. That is up to the infected individual to disclose that information, but I will not. I contact close contacts and discuss the CDC guidance around exposures, which currently still remains at masking up for a full 10 days after the date of exposure, and to test on day 6. So masking for 10 days means refraining from any activities that would have you out of a mask, such as dining with others, singing, things of that nature, not using the pool, because that would be without a mask. The reason why those steps are so important is because we want to prevent intra-community transmission. We want to prevent having to go back to modifying programs, having to scale back dining. Those are the things we are trying to avoid. So of the more recently infected individuals, there have been a number of close contacts. Boy, you've been busy. You've been busy interacting with others, and that's fabulous. And so hopefully you've seen more masks. And I have seen a few close contacts I contacted that I later saw without mask in those 10 days. So I followed up and reminded those individuals, please wear your mask. So it is important. And I just would like to ask everyone to do the right thing and mask up if you've been notified of being a close contact. Close contact is defined as being within 6 feet for a cumulative 15 minutes or more in 24-hour period. So, you know, if you were sitting next to someone at a meeting, a program, an event, dining with others, those are close contacts. Certainly the risk drops a little bit if there are masks involved, drops significantly if you are outdoors with someone, but there is still risk. So that is the process. The other thing, the final thing that I do for infected individuals is talk about the isolation accommodations, which I've shared in the past. And that is when we want the isolation, we want to make sure you have the support during those days of isolation. So that is waiving meal delivery fees. If you order food from the terrace dining room or the bistro, that means calling reception for recycle or garbage pickup outside of your doors. That means delivering packages and deliveries you might be expecting, arranging for laundry if you don't have laundry facilities in your apartment. So we want to know if you have been infected, and as well for influenza or RSV, so that we can put those accommodations in place to support isolation, okay? Talked about contact tracing, home test kits. You've heard me mention home test kits. Horizon House has never supplied home test kits for independent living residents. We've been very clear in the communication throughout the pandemic and have posted links for what were the free home test kits through the federal programs and the state programs. We communicated before May and in May that the public health emergency, with the sunset of that in May of this year, also came the sunset of all those free programs. And so you're all responsible. All of us are responsible for acquiring home test kits. The public health emergency changed what insurances are required to do now. So original Medicare does not cover home test kits. Medicare Advantage plans have the option of covering home test kits or not. And public health insurance companies do not have to cover home test kits. They vary in price. Most single tests are about $8 to $10. Often they come in two that might be anywhere from 15 to 20. Readily available on Amazon. A lot of the pharmacies have them, drugstores, grocery stores. I called Bartels on Madison and Bourne yesterday to just inquire. They have some in stock in the pharmacy and some at the front of the store. But they said they do recommend calling before making a trip if you're only going to get the home test kits, because sometimes they are running out of them and have to wait for more shipments. If your insurance does not cover home test kits, my strong feeling is you need to treat these test kits just like you have in your medicine cabinet a tube of Neosporin, just like you have a box of Band-Aids, just like you may have some Tylenol. home test kit is one of those things that I encourage you to treat as if it were another over-the-counter that you just always have in your medicine cabinet, because you never know when you may get that call that you've had an exposure or you start to feel symptoms. I want to remind you also, HH Connect has a link on there as well. For those of you who have expired test kits, take a look at that link so that you can see if it's been extended, or you can call the manufacturer directly on the test kit to see what they can tell you about expiration dates. Communication. We have been keeping HH Connect up to date all times with active COVID cases. Since July 20th, we have had a total of 10 COVID cases in the community. All 10 have been independent living residents. The case count has always been kept up to date with current active cases. So when a resident or any COVID case is recovered, that case comes off the case count. I heard there were rumors of 12 cases. I'm not quite sure where that rumor came from, unless there are some residents who did not report. I want to really put a plea out there to please report. There is nothing punitive about reporting. This is coming from a place of we want to support you. We want to make sure you get the support systems in place for your period of isolation and to provide guidance in your recovery process. So unless others have not reported, we have had 10 cases total since July 20th. I want to be very clear about that. Some of those cases were exposures outside of the community, travels, weddings. One was a wedding. One was a birthday gathering outdoors, outside, and the rest of them were unknown. And that's not uncommon. Sometimes it's really difficult to ascertain where those exposures occurred. So be aware that home test kits with these newer variants may not necessarily pick up a positive case right away. And that is the danger of COVID, is some people may think they just have a common cold. They test for COVID. I'm negative, hooray, I'm good. I'm going to go on out. But it's very common now for those home test kits not to show positive until one is 3 to 6 days into active symptoms, which is why we have continued messaging, and I will continue to message. If you have any symptoms, even if you think it's a common cold and you test negative, please stay home, because you don't know if it is. You don't know if you may be going into influenza. And I do think we may see a real sharp increase in influenza this season because masks are off in the general public everywhere. So we can anticipate that we may see more influenza cases this fall into the winter. So please, please, if you feel symptoms, do the right thing, stay home. If there's something you really have to go do and you've tested negative for COVID, please mask up. If there's something that is critical and essential, otherwise stay tucked in. Wrapping up here, vaccines. I know a lot of you have been asking about vaccines. We do have influenza vaccine clinics lined up. Just got some final dates yesterday from Rite Aid Bartels. And the first one will be occurring on September 21st. The second influenza vaccine event will be on October 27th after the fireside chat. So I want to assure you, we'll convert one of these spaces and start kicking it off on that day around noon. So I am still waiting to hear for those of you with Kaiser insurance. Kaiser is changing. And we are hearing, as they told Bartels and Rite Aid, that they are not going to cover vaccines administered outside of their Kaiser clinics. I have made several calls. I'm not making much headway yet, but I'm not giving up to see if Kaiser will give me any kind of assurance that they will cover for vaccines administered by Bartels here on site. Otherwise, I am asking if they would consider sending a vaccinator for those of you with Kaiser. So I'm going to keep trying. We've got some time before September 21st rolls around, but I'm not comfortable without being able to offer some assurance of what those of you with Kaiser can expect. I am being told that if Kaiser did not cover your vaccine, your out-of-pocket fee would be $94.99. Not small change. So we will communicate as we get more information. The COVID boosters that you're hearing about in the media that has not been rolled out yet, they anticipate some kind of a program rolling out, could be later this month, may not be till September or October. I don't anticipate that it will be in time to roll in with the first flu vaccine. I'm waiting to hear from Bartels Rite Aid, the rep I'm working with, what are they hearing and whether or not they can be administered at the same time. The RSV vaccine that is supposedly going to be coming out. Right now, they have not made a broad announcement because of some concerns with the vaccines and atrial fibrillation. And right now, the recommendation is to have a discussion with your doctor about an RSV vaccine. So I'm not clear yet if that means they will not do the large rollout and set up big clinics, but instead if that will need to be more on a case-by-case basis. What the guidance is saying right now is RSV and influenza vaccine can be given at the same time. So for those of you who have doctor appointments coming up in the next month, 6 weeks, if you are a candidate now per discussion with your doctor for RSV vaccine, you may want to consider getting both at the same time. And so certainly as more information comes out from federal and state level, we'll be sure to get that communication out. Last thing I'll say is let's be careful with the rumors. You know, a lot more cases than seem to be out there. Some mistaken identity for somebody who wasn't wearing a mask and should have been, and actually they were. So I just want to really encourage everyone to be mindful, be careful with the rumors, be assured that we are carefully tracking the cases. Please report so that we can be of support and help get you on your road to recovery. And just don't make assumptions. We may naturally start seeing more masks, not because someone's been exposed or someone thinks they have symptoms, but just from a protection standpoint. I know some of you still have weddings to go to, family gatherings, and some of you have expressed wanting to be more protected. I can completely understand that, but let's be careful with assumptions as more masks may start appearing just from a precautionary standpoint. That is all I have. Any quick questions? Nancy?
My question is, if you live with someone who has been exposed, we've always assumed that, you know, like if in the case of my husband, if he's been exposed, but I haven't, that I'm still going to go in the community wearing a mask. Is that what you would recommend?
Being in the same household, yes, I would. Technically, you're one removed from the direct exposure, but in the same household, I do recommend a mask be worn. All right. Thank you very much. I'll be sharing a lot of the same information at the fireside chat. So if you are dying to hear it all again, come to the fireside chat. Okay, next on the list, it says Deanna Nelson. Thank you.
Thank you, Lauri. Having just gotten over COVID, I can tell you how important Lauri's talk was and how helpful they were. And I ask you all to try to avoid it. It can be very unpleasant. You don't want to get it if you haven't. I thought I was immune because I had gone this far without getting it, but not so lucky. Okay, I have a lot of business to cover, but I'm going to make it brief. I'm going to condense what I was going to say because we've got a lot of people who need to talk today. As you know, those of you who know me, I'm a bit of a computer nerd. And since I've been here, I've been, you know, beating that drum. And so I have something really concrete to report to you now. After a long time, almost 6 to 8 months of work, we have amended the bylaws, which were not really bylaws, which I found out by looking at Horizon House Corporation's bylaws. Our bylaws were 27 pages long. The corporation's bylaws were 7 pages long. So I looked into what bylaws should be like, and I found out that they should just reflect the basics per your articles of incorporation. That's it. So we formed a committee to amend the bylaws, and Carol Roach and Judy Ostrow and Ned Lang and Marianne Anderson all worked on it and came up with bylaws the way they're supposed to be. And in the interim, then I worked on creating an operations manual, which contained all of the operating stuff that was previously in the bylaws and all of the paper that we had that was floating around from year to year, from president to president, that some was outdated, some was not in electronic form to modify, some was just wrong, and some was missing. So anyway, with a lot of help, I got this operations manual done. Louise Alburis helped edit it. And then Carl Swenson, I don't know how many, is Carl here? No, I don't know how many of you know him, but he's a true expert. He stepped up and put it in a really nice manual form. And Carol and I put it together and passed it out to our members. There's a copy in the library on the back shelf to be looked at in the library, and there'll be a separate book for minutes and financial statements. Don't take those books out of the library, please. And then relatively soon, the whole thing will be put up on HH Connect under the Residents Council tab, so anybody will be able to see it and look at it. And we will easily in the future be able to amend it, but my hope is that we won't need a lot of amendments, that we've done a good enough job that it'll carry us through for a while. So that was big job and a relief to have it done. Carol and I did a happy dance when it was finished. I'm not kidding. I have several announcements to make. Ruth Ann asked me to talk to you about the enrichment grants, formerly the GEM grants. The enrichment grants are funds that are available to staff members and residents and committees for the benefit of Horizon House. And $50,000 a year is available, $25,000 each half year. And you would make an application to the philanthropy department, and they will help you do that if you have an idea that you think is worthy. And they will fund it after a vote by, there's a philanthropy committee that's composed of trustees and also residents. And they'll look at your application and decide whether or not that's something they want to fund. And it's really a really nice program. And some of the things that have been funded by the enrichment grants recently are the labyrinth on level C deck. There's a raised indoor garden for assisted living. There are t-shirts for the string-alongs, quilting machine in the sewing room, and table lamps for the dining room. Now, table lamps from the dining room, I'll bet 90% of you have no idea that they exist. They were purchased last year in the winter, and there's two types of lamps. There's a lamp for the center of the table, and then there's a kind of a high intensity reading lamp for people who can't read the menus, but they're not kept on the table because they're portable and nobody wants them to disappear. So I'm telling you all that they exist. When winter comes and it's dark in there again, you can ask your server. The servers don't always know about them. Ask Oliver or ask Jeff, and they'll bring the lamp out to you. And I'll try to remind you again when it gets dark, because they're very handy. The next thing, the deadline for the enrichment grants is September 11th. So there's not much time left. So if you have some ideas, get them in right away, and go to Ruth Ann if you need help. Or Karen Smith has also offered to help anyone who needs help preparing one. On September 16th, there's going to be another tech cafe. Some of you came down to that last time. Alex Tibbetts, the VP of the Board of Trustees, and her son, who's a student at Northwest School, come. And I was with them last time. I probably will be this time. And we help you with your computer problems. We help you to solve problems. And it was really nice. There were about 6 or 7 people who got some help and managed to walk away with their computers working. I don't know how long that lasted after they got to their apartments, but they got sent off with solutions. Another important thing is that meeting rooms can now be scheduled for a year at a time, but on a calendar year basis. So you can't schedule a year from now to this time next year. Starting on January 1st, you can schedule for the full year 2024. But don't go to Jess yet. Wait until November and then talk to Jess about scheduling. So I think that's going to be a big help, not to have to remember somewhere in the middle of the year that your room's going to be gone. And finally, for Horizon House type announcements, alert submissions now should be sent in using HH Connect. There's a form on HH Connect that you fill out. There was training for people who generally do alerts frequently. And if you didn't get training and you need to do an alert and you can't find the link on HH Connect, Emily can help you with that. It's very easy. You need to put in the basic information, but it gives them the information in a standardized form so that they can process everything in the same way. The rules are the same. Oh, there will be another training too, so look out for that. And for the final announcement, this is kind of interesting, but our postman came up to me a few weeks ago and said, could I please help him? And I said, help him with what? And he said, he was born with congenital hearing problems and he wears hearing aids and then he muffles his hearing because he gets too much feedback. And when people come up to him and ask him, is my section done? Is my section done? Did you use this? It confuses him. It messes up his train of thought. He has to start over again. Sometimes 20 people will ask him that in one day. And he asked if we would all please, and I admit I've been guilty of that as well. We all should let him be. And when the sign says the mail has been delivered, just go in and get our mail. So I ask you to please do that for him. He was quite frustrated and upset. And he doesn't want to be mean to people, but he didn't know what to do. So that's my message from him. And one more thing, in olden times, I think some of you remember that, the council members used to sit up front in front of a table with their names on the table, so you would know who they were. You would know who your president council members are. We don't do that anymore so that they can see the speaker and they can see the screen. So today I would like all of the council members who are here to stand up, turn around, face you, and just tell you what their name and their job is. And if they say they're a coordinator, for those of you who don't know what a coordinator is, coordinators are given a group of committees to work with, and they assist the committees in whatever the committees need assistance with. They're there for the committees. So council members, stand up and we'll start down at that end and come across.
I'm Nancy Olson. I'm the coordinator for the assisted living committees. I'm Sally Wren, and I'm coordinator for the Employee Recognition Fund, which will be coming up soon.
I'm Ann Kelly. I'm the coordinator. I'm I'm a liaison coordinator, which means I work with committees that also work with the administration.
I'm May Gerstel, and I'm the coordinator for education committees. And they do just what the word means.
I'm Jeff Graham. I'm the coordinator for social events.
I'm Sam Sperry. I'm coordinator for the discussion groups, the environmental groups, committees, and I'm assisting Sally on the Employee Recognition Fund.
Judy Ostrow, and I have the most fun because I do games.
I'm Carol Roach. I'm Vice President for Administration.
I'm Karen Smith, and I'm treasurer. Is that better? So with money.
I'm Jennifer Stucker, and I'm a non-voting member, and I'm co-director of the Monday Market.
I'm Nancy McReynolds, and I'm the secretary.
I'm Wilton Fowler, and I'm coordinator for the entertainment committees.
Thank you all. They all do a wonderful job, and I'm very grateful to have them working for us, with us, and among us. So say hi when you see them. Next, Erica.
Thank you very much. Good afternoon, everyone. I'm going to do the CEO report. This is my first report, so I'm excited to be here with you, but I'm going to keep it very brief because I realize we are a half an hour in. So I just want to do some bright spots first. Many of you attended the ice cream social. That event took place my first week here. It was outstanding. We got to see so many residents who came out and supported the ice cream social. I'm sure you'll be getting an update, relatively soon around how much money we've been raising through fundraising events like this. I also want to talk about another bright spot, which was my self-intro. I want to thank all of you who came out to hear, a bit about my life and to support, my journey into Horizon House. And it was an awesome opportunity for me to connect with residents and staff around a variety of things. And I believe from that experience, we might get a French club started because I found out that so many of you spoke French. I want to talk to you also about the staff appreciation picnic. Many of you saw last Thursday that we had our staff appreciation picnic, which we have every year. It was very well attended on all shifts. There were several of us here, we're here, from the day shift through third shift. And again, it was fun. Some of the highlights, if any of you happen to pass by the terrace area, we had a margarita machine. No alcohol, but there was pina colada and strawberry daiquiri, which the staff really enjoyed. We had prizes, everything from candy to little stress balls to actual gift cards to places like Starbucks. So it was a lot of fun. We had a limbo contest, which was a lot of fun. I will tell you that the top 2 limbo champions of the Horizon House staff are Brenda in HR and Andrew in the wellness department. So if you ever want to challenge them, just be aware that they go low. And so it was a lot of fun though. I have had the great pleasure, probably one of my favorite events has been attending the Sunny Mondays. Oh, I'm going to miss Sunny Mondays when the fall hits, but I have enjoyed, it's given me an opportunity to really connect and meet with residents, but I will just say it's a great opportunity for fellowship. So you'll see me next Monday. A little bit about the West Tower update. We have had meetings, and so we want to keep you informed. Our D&E stack groups met with Methuen as well as Anderson to be able to see, and this is D&E stack from the Central Tower. I'm still learning all the towers, but they were able to see, like literally have an idea of what their view was going to be after the West Tower went up. So all that took place. We have West Wing residents who are starting to move into new apartments on campus. We're actually ahead of schedule. We anticipated about 15 moves this year, and I believe we're at 12 already. So we are, moving forward. I also want to talk a bit about the market study. Many of you might have heard in other updates that we are working with an organization out of Mississippi called Promatura. Promatura is, the top marketing firm for senior living organizations in the country. I worked with them in my previous role as well. And so they held 2 focus groups at the Washington Athletic Club in early August to really test out what it is we are doing with our expansion, both testing the price of the market as well as the product. And although we don't have the final results in, they are, being tallied, they're being analyzed, which we'll have in about a week or so. The preliminary results are very positive. And so, some of the things like our location, the type of community that we have, all of these things that were asked were just very favorable. So I'm looking forward to sharing those results with you in the future. I want to introduce you to a new staff member who I know you're going to be very excited about. Nick LaSalle, can you stand up and wave for everybody? All right, so Nick is our long-awaited guru of everything audiovisual. He's going to help take Horizon House to the next level. So a hand for Nick. So all of our wonderful, programs and different things that we have, as well as some things that we haven't imagined because we didn't think we could pull it off, Nick will be able to help us with. I was so excited to report, I really just finished my first CEO report, and already I'm starting to work on my second. But the CEO report is just another way to stay in touch. In that report, we talk about finances in really matter-of-fact terms to keep everyone informed. I promise to be transparent, and that is one of those ways that I will continue to be transparent. And then just to make sure everybody knows and has it on their calendar, the fireside chat will be Friday, August 25th at 10 a.m. live in Anderson Hall, as well as being streamed to the Horizon House TV. And then lastly, as I wrap up, it's time. It's that time again. We're ready for our quarterly small group sessions. They will be held next Tuesday and Wednesday. If you are interested in attending those small group sessions, please contact Beth and she will get you registered for one of them. So I'm going to pause to see if anybody has any questions before I turn it over to Nancy McReynolds. Does anybody have any questions?
The model of the West Tower that was over by the other side of the library has disappeared. And I was told the reason is because a redesign of the West Tower is in the works. Do you know anything about that? Is that what's happening?
That is true. Not a redesign in the way that we might think about it, but more updates, just so you can see more details around what the space is going to look like. So, really kind of the same model, but you'll be able to see where terraces are and walkways are. So just an upgrade, if that makes more sense. All right. Any more questions? Going once, going twice. Okay, I'm going to turn it over to Nancy McReynolds. Thank you.
The minutes of the June 2023 general meeting for the Residents Council of Horizon House have been distributed. Are there any corrections? If there are no corrections, the minutes are approved as distributed. Karen Smith.
As you can see, life goes on. We're going along quite well. We are probably not going to approve any additional money for any particular one item on the budget because we are feeling the need to stick within our means, and Monday market sales are not quite what we had first anticipated. And but anyway, actually everything is good, and I just appreciate all the people that are contributing to the culture that we have created here. And so as treasurer, I just say, yay. So anyway, and then I want to turn it over to our guru from the Monday market, Jennifer.
We've been busy in the Monday market. People are moving in. People are sort of relocating to other parts of the building and to the campus. People are going to assisted living. Some people are passing away. So a lot has been happening with new items arriving and the need to go to the apartments and help people to decide what they want to donate and what they're taking with them. But that always happens, but it's just been a lot of it lately. So this report covers the financials from June and July together, and then for the first 2 weeks of August. So for June and July, the total deposits were 18,887, with the net of 17,126. And taxes, basically a tenth of that. For the first 2 Mondays of August, total deposits were $5,085, with a net of 4,612. Thus, the net income for those 11 weeks from June 1st on is $21,738. Employee weekly charges continue to average just about 300, and sometimes more. So in other news, I requested in last week's alert that winter clothing not be donated until October 1st. The plea was again repeated in this week's alert. So basically, we have no place to store the things because we are full to capacity. So wanting to treat your items well, please, if you can hold on to them till October 1st when we start to put out winter clothes, that would be much appreciated. Oh, we also have an adequate, if not abundant, supply of brown paper bags for right now. So you can hold on to those too. Barbara and I have met with Methuen several times and are both impressed and pleased with their plans for the market in the West Tower. It will be larger and more efficient for both shoppers and workers. 3 of the Methuen staff visited the market a couple of weeks ago. They took photographs and they also asked questions and answered our questions. The market will be closed again this year for Christmas holiday. Mondays fall on December 25th and January 1st. So the bins will be closed from December 20th to January 4th. Volunteers will have the time off, but they're welcome to help out if they are available and willing. Barbara and I are looking forward to our meeting with our CEO, Erica, this week to discuss the Monday market. Barbara informed me that her last day as co-director will be December 16th of this year, the end of our terms. Her contributions to the market cannot be overstated. She will be missed. I keep telling myself December 16th is a long way off, but obviously it is not. But the search for a replacement is on. I've been talking with various volunteers and their interest in the position or ideas as to others who may be interested in the position and willing and able to take it on. Is that you? And next up to knit all this together is Patty Flowers.
I am accompanied by one of my fellow knitters, Faith Bowers, who you will see in the slides. Okay, short and sweet, the knitting group meets every Thursday from 10 o'clock to 11:30 in the Robert Durham room. The group is for everyone, from beginners to experienced knitters. You see those neat hats there? Faith made those. She does great work. Crocheters are welcome also. We do not discriminate. Also, we have donated yarn and needles and crochet hooks to keep you started. So if you don't have any materials, don't worry. We get donations all the time. It's really terrific to see what we can make with what we are donated. And we even welcome you if you just want to come by and talk. We talk a lot. Anybody who's come by that Robert Durham room on Thursday mornings know we talk a lot. That's part of the fun. We can help you with finishing a project or with beginning a project. A lot of the things that have been donated to us have been half-finished projects. That's part of the fun, is finishing them up and seeing if we can do it. Or maybe, whoops, went way ahead. Maybe you need help figuring out how to do some of those patterns and colors. Believe me, we have people that can help you. Faith is one of them. Many items are donated to shelters or sold, and money donated to the staff fund. Last year, when Mary Ann Counts had the sale in November, the Christmas sale of artworks that people donated, we sat out in the hall. We had my jewelry, and we also had all the knitted things that we had saved up. We gave $1,000 to the Employees Relief Fund, and that was just on one day. And then we took maybe 3 huge plastic bags full of hats down to Mary's place. And there's a shelter for juniors, young people that's north of the University District. And we took a big bag of things out to them as well. The fun for us is making it. It's not getting the money. These are some of the projects that have been knitted, and a lot of these are donated yarn. So we'll see you Thursday in the Robert Durham room from 10 to 11:30. Come drop by. And now our next person is Judy Ostrow. I thought I was going before you. That's her bumblebee hat. You see that?
Well, I'm going to speak to you about the Saturday night movies. I have a co-chair, Judy Ramey, but she is currently spending the month in England, poor thing. For many of us, our introduction to movies was the Saturday matinee, which you shared with other children in the neighborhood. Was nodding heads. Through the movies, you traveled to other countries and times, and you cheered with the triumph of the good characters over the bad. Some movies reflected the home and school life of your own, and you sympathized with familiar situations, grateful for grateful for a resolution which benefited everyone, especially your peers. During World War II, you knew who should win each conflict and you applauded the winner. As we grew older, the movies also became more sophisticated in their themes and more realistic in portraying social and personal concerns. But there were still the journeys to distant times and places. The Saturday Night Movie Committee continues the tradition by choosing a variety of movies from golden oldies to new releases. Our guideline is that the language is in English, although we are forgiving when we expand to British, Irish, or Australian. And we include a variety of genres, such as dramas, comedies, and musicals. For example, during the present quarter, that would be July through September, our offerings are set in a medieval monastery, wartime and present Britain, the American Old West, and contemporary American Midwest, New England, and Brooklyn, with time frames from the 14th century to the present. The movies we present don't appear magically, so this is how our committee operates. We meet 4 times a year to plan for the next quarter. Each member in turn proposes a movie, and we respect each other's choices. Rarely is there disagreement. We allow 5 years between the showing of a particular movie. That is, well, we don't show it less than 5 years at a time. Our choices are thoughtful, and we select good and great movies for you, our audience. These are movies with conflicts, either internal or situational, which require the characters to strive to achieve a resolution through courage, creativity, compassion, and in many cases, humor. The member is then responsible for obtaining the disc, viewing it to check for flaws in subtitles, submitting a timely announcement to the alert, and delivering the disc to the reception desk. Our sources for discs are private collections, the public library, or Scarecrow. This latter one, it involves the help of someone with a car. Netflix, I understand, will no longer be available, but we'll have to find a substitute. New members are always welcome to join the committee if they are willing to assume the responsibility for their movie choice. We're still showing our weekend movies on HH channel 340. While we are debating whether we will have live showings in Anderson Hall. We are going to offer another 3-movie live festival in September, created by 2 of our members, Karen Lane and Sam Sperry. The subject will be the also-rans of 1939. This was the year which Gone with the Wind swept most of the awards, but there were a lot of other fine films, some of which they're going to share with us. Questions about our committee? a couple of minutes less, and I invite you to tell us about a movie which had an influence on you. That's were you deciding to be a doctor, a naval officer, or climb Mount Kilimanjaro? Anybody want to share anything? You've all seen movies. Well, thank you for your time. Do enjoy the movies. Sorry, Carol Roach.
Hi, everybody. It's time for some burning questions. Burning questions can come from any resident about any topic related to Horizon House. I do my best to get the answers before the next month's regular Residents Council meeting. Today's first question, and there are two, was asked by two residents who use the North Tower garage. They wonder if the shortage of parking spaces there could be remedied by a redesign of the way parking spaces are allocated, especially for SUVs. In some cases, an SUV must use 2 regular spaces. Could a special section of the garage be redesigned with spaces marked to accommodate these larger vehicles? If necessary, owners of the very large vehicles could be charged more for the extra space that they require. What space redesign options are fair, reasonable, and practical? The response comes from Brian Holtz. And I quote Brian, "The overall design of the Terry garage and especially the columns there have created definite challenges for optimizing garage stalls ever since the North Tower opened. I can certainly review with Michael Andres, our garage supervisor, the concept of parking allocation by vehicle size. North Tower residents self-park their cars, often in very tight spaces. If all of the spaces were used, some residents with mobility limitations would suffer because they can't get in or out of their cars unless the car doors can open completely. As a result, some vehicles are allocated extra space. In the university garage, where all vehicles are valet parked, Michael does have designated locations for the valet team to park SUV vehicles and other vehicles based on size and height clearance to optimize our spaces. We do not charge a different fee for any parkers, residents, guests, or staff based on vehicle size." This is Brian speaking. To be honest, I'm unsure if that would be a direction in which we'd like to go. Thank you, Brian Holtz, for that answer. Here's the second question for this week, and it comes from a resident who's been in our community for a while. She feels nostalgic about the Jenny's Jaunts, the bus outings that Horizon House used to offer to residents quite often, and she's hoping they might be revived. The first answer came from Lisa Ransom. She said that one reason the outing stopped is that those that were offered didn't draw much interest in recent years. The announcements went out, the driver and the van were booked, but only a few residents participated. The second answer to the outing question came from Brian Holtz again. Brian's response is this: "We used to have more staff structured outings. However, a combination of factors diminished those opportunities. One of those was, of course, COVID. We had a driver, Jenny, as in Jenny's Jaunts, who coordinated and provided numerous outings pre-COVID. Jenny retired a few years ago, and we've struggled to find a new full-time driver for our shuttle. We are still trying to hire for this role. Jenny, however, actually returned to work with us, but only for a few hours a week. Various residents' council committees, including the neighborhood committee, the art committee, spotlight committee, and others, sponsor outings, and often Jenny is the driver. But her hours are not enough for us to provide the number of outings that we had in the past. Horizon House would like to provide more outings and perhaps will once we are again fully staffed for this position. My thanks again to Risa and to Brian for their answers. So now it's your chance. If you have a concern about anything related to the Horizon House community, please meet me, Carol Roach, in the Fireplace Lounge right after this meeting. I'll be there for at least 30 minutes. So you write down your question and I'll pledge to find an answer. Bring your burning questions to the fireplace. And now to Deanna.
I want to remind you all that the dining committee will be set up in the Fireside Lounge as well at a table where you can bring your questions, concerns, comments, and they're happy to see you and talk to you. So please go see them. And does anyone have any questions of me? Then I will adjourn the meeting. Thank you all.